Chairpersons and my dear colleague, I will be speaking on multimodal strategies for public awareness in diabetic retinopathy. As we know, a successful program to combat diabetic retinopathy in part relies upon the level of awareness about diabetes in the community. It appears that awareness of diabetes and diabetic retinopathy is relatively low in many parts of India, making it difficult to engage in preventive actions, diagnosis, or treatment. In a study done in southern India, it was found that awareness that diabetes can cause diabetic retinopathy was present in only 28.8% of the urban population. The aim of our study was to find out the best possible method for increasing the level of awareness in the community about diabetic retinopathy, screening and treatment. In this study, all the screening and treatment programs camps organized between November 2009 to December 2012 were included. All the camps were organized in the Bagpat district of the Uttar Pradesh. On the day of surgery, a team comprising retina specialists, optometrists, and other team members will go to the venue in a mobile van equipped with portable angiography and laser machine. All the patients requiring angiography and laser were done there itself. As we know, there are three main approaches for any public education program. When a large section of the community is approached, it is known as the mass approach. When a specific group is targeted, it is known as the group approach. And when a specific individual approach, it is known as the individual approach. In mass approach, we have poster depicting the effects of diabetes on the various organs and their prevention. And the posters for the awareness of diabetic retinopathy, they are intended to raise general awareness, and they are contain illustrations depicting the effect of diabetes and retinopathy on the retina. In the similar way, we can make some calendars which can be put on the various places. A small pocket calendars providing regular encouragement for diabetic retinopathy were also made. The main purpose of organizing press meetings is to disseminate knowledge about the diabetic retinopathy with various articles in the newspapers. Awareness can also be
यदि आपको शुगर है तो आपको अपनी आंखों की जांच हर 6 महीने में
these awareness campaigns by celebrities can also be done, and by awareness campaigns in the FM radio.
यदि आपको शुगर है तो आपको अपनी
coming to the group approach, various seminars and lectures can be organized. This main purpose of the seminar is to engage the physicians and hepatologists, so can the and also the local health workers and medical personnel. In these booklets were distributed, which contains the basic information about the effect of diabetic retinopathy with various stages, and the ideal follow-up schedule was included in that. By celebrating special World Diabetes days like World Diabetes Day in schools and etc., a large section of the community was approached, which in turn provided the large section of the community was approached. Patient intersections were held at the campsite, followed by a short presentation and a question and answer sessions. We can also make pamphlets which contains in the vernacular language containing the basic information and stressing the importance of early detection and brief information about the diagnosis and treatment of diabetic retinopathy. Individual counseling sessions were also held, which provide a perfect opportunity for one-to-one interaction. In our experience, we found that all these approaches are useful in urban and semi-urban areas, but for less useful in rural areas, because people vary so widely in their social-economic conditions, tradition, attitudes, and beliefs that a mixture of different approaches are required. As we've seen in the camp, that when we give some pamphlets to the patient go outside and he throws the pamphlet. Most of the patients who come these camps, their motive is to get a free eye drop. So we developed an educational movie to impart knowledge about retinopathy, covering all the aspects of diabetes and retinopathy, in which a protagonist who is a diabetic and is based in rural area is repeated counsel as is irregular in treatment and follow.
भी नहीं दिखाई दे रहा, ठीक है? अभी आप बाद में देखिएगा, उस जगह पे ध्यान से देखते रहिएगा, उस जगह पे सफेदी सी आएगी, दिख रहा है आपको? हाँ जी, हाँ जी, हाँ जी। ये बेसिकली लीकेज है, इसी को हम टेस्ट इसलिए देखने के लिए करते हैं कि
on the first follow-up, angiography and laser procedure was shown so as to allay the patient's picture.
धर्मू आके मुझे अस्पताल लेके गया दिल्ली इलाज के लिए.
Importance of the follow-up was also emphasized. A sensitive topic of leaders.
कहाँ फिर रहा है? राम राम बाबा, राम राम.
खुश रहो, आनंद करते रहो.
और बाबा
कहाँ फिर रहा है भाई? कहाँ गया था?
बाबा दिल्ली से आ रहा हूँ.
काहे के लिए?
बस आंखों को दिखाने गया था बाबा.
अरे आप
वही.
The movie ends in the positive note. The protagonist learns from his mistake and in turn takes upon himself to educate the fellow villagers. In our study, total 22,540 patients were examined. Initially, there were 45. After these 45 camps, they were done with the conventional approach, and the next 95 camps in the movie approach was used. So our results showed that a new approach of movie showed approximately significant increase in diabetic patients and 17% increase in patients opting for the laser treatment. Diabetic retinopathy is a major cause of blindness and probably has implication in India. Prevalence of diabetic retinopathy in South India among a patient over 50 years was found to be 1.3% in one study and who is going to increase exponentially in the coming decades. In conclusion, I will like to say that people vary so widely in their social conditions, tradition, belief, and level of knowledge that uniform communication approach is not viable. A mixture of different approaches must be available depending upon the local circumstances, and we have to constantly evolve new methods of screening and awareness. Thank you for your patience here.
So, according to you, which is the best?
Sir, I said in my talk that you cannot say a particular method for a particular area. Depending upon the level of the knowledge and the awareness in the community, you have to devise new methods, and a mixture of approaches needed in the different places.
So what was different that you did in your study? Usual screening and awareness programs.
So we followed the conventional approaches in the first few camps. We could not get the desired results. So we got the idea of making this kind of a documentary drama in that area only. And this is a 45 minutes movie. And I've just shown the clips. And this movie was shown in the local area, in the small cable network and in the small theaters. So it was an interesting movie. The patient also got the message from them, and they more receptive for the
local radio for the local population in
yes.
their language.
Yes.
Because you said it correctly that most of the camps they don't go free eye drops and they close the camps.
Do we have Dr. R.C. Singh